Okay. Okay, Viral, bye. Sir, Dr. Kalekar. Dr. Talekar, Dr. Saurabh.
Yes, sir.
Okay. I am Dr. Rishikesh. I am doing general practice. Hello.
Yes, sir, we can hear you. Please continue.
I am doing general practice, and since this COVID has started, in a Ghatkopar, I have set up 10 community clinics. And on an average, we see daily in one clinic almost 100 to 150 patients free. And according to me, there is lack of real knowledge in that particular case. I feel this will spread like anything. People doesn't know the consequences. They don't follow the social distance. Even many people don't wear masks. They use dupattas, especially females, and young generation they use hankies, which is not good for them. But in a community clinic, we guide them in a good way, and from on an average, we suspect 3 to 4 cases, and last couple of days almost I detected 15 COVID positive, and out of that 6 are admitted in Rajawadi, 2 are in SRV, and 3 in Horizon. Then okay, most important thing, 2 or 3 people were asymptomatic. There was no symptoms. So how you can help me?
So let me start with a little bit of introduction. So my name is Dr. Saurabh Talekar. I'm an orthopedic surgeon. I practice at Wholistic Care, which is located in Vidya Vihar, and I'm the founder and director of Wholistic Care. This is my disclosure and my education. So I will, before I answer your question, I would like to give a little bit of introduction of what I do. So I practice holistic orthopedics. What is holistic orthopedics? I am trained in joint replacements, knee and hip replacements, but we realize that a lot of orthopedic disease is caused due to various factors like stress, smoking, alcohol, sedentary lifestyle, long traveling hours. So we try to fix things around it, which are conservative. And we use medications and surgery as a last option. So this is my treatment protocol. I do not want to bore you with the whole treatment protocol, but it's basically treatment provided for mind, body, and spirit. That is what we do. So this is what, to a physician like you or an anesthetist, what a orthopedic surgeon is. Let me fix the bone first, and then you continue with your CPR. So I consider myself not among those, and I think good in treating patients in a holistic way. So when the lockdown began, our practice is shut down. What we usually like to do, the knee replacements, the hip replacements, and spine surgeries, they all shut. So I had nothing to do. So I started researching. So I read a lot of literature from the ICMR, from the WHO. These are the certified courses I took from the WHO, and that is the reason I feel I am capable of speaking and addressing this crowd. I have some information of what limited information is available on the internet. So I will get ahead with the situation what you were talking about. Dr. Rishikesh, you said there's a community clinic set up by you, and which is a really nice initiative you've taken. I know I've visited your clinic. You see almost 500 patients there, and this is the direction of the BMC, the municipality and the government, that they're telling all of the practitioners to open all of their clinics and keep it open, keep it functioning. Now, even there are some mails from the MMC saying that private practitioners will be called to the closest BMC hospitals to practice there. I do not have any update on that one, but that's why I wanted to know what exactly can a single doctor, a single practitioner who owns his own clinic do to his clinic? So that's why I went through the literature on all of these three sources. One is which is the ICMR, second is the WHO, the World Health Organization, and the Center of Disease Control and Prevention. And I came to realize that there's nothing there for people like us. They have information for country level preparedness. They have information for big hospitals. They have information for public sector hospitals. There's nothing for a primary healthcare setup or in a setup like you or, and me function, and a lot of our colleagues do. And this single doctor clinic is the basis, the pillars of healthcare in India, is what I believe, because you go to a hospital once, twice, or thrice in your life, but you go to your general practitioner every month at least, or maybe weekly. So I will tell you, sir, what I have done to my clinic, and we can come and understand to see what can be done and how can we follow all of these regulations. And I should also understand that what the dilemma is. Why is there a dilemma? There is one big thing in the heads of these consultants is, if I open my clinic and if I buy all of these PPs, if I have to buy all of this every day, if I have to spend a lot on PPs, and if I have to see one or two patients in a day, even the patients are not feeling safe to get out in the lockdowns. That's why in these small clinics, patients are little lesser, and all of the load has gone to the big government hospitals or the community centers like what you have started. So the dilemma is, can I cover the cost of the PPE and all of the precautions taken by me by seeing these limited patients? So that's why, should I open my clinic? Should I start practice again, or should I not? So that is the dilemma. So let's see what we've done here. Earlier, at your left, my clinic used to look like this. You can see the decorations and all. So at the right, you can see I've closed down all of the decorations. Uh, Before, it is recommended to have a flu desk. What is a flu desk? Uh, for bigger clinics where there are 4 to 5 practitioners, you can assign some person who will stand outside and he will ask patients whether they have symptoms related to COVID or whether he has any exposure to any kind of COVID patients. If any doubt, and they should have thermometers. Preferred are the infrared ones, the gun ones. But in case you don't have them, you can use the normal ones. If these cases there is a suspicion, then you should go ahead and you should know 3 things before you start. 3 things what you should know is the closest center which where you can send the patient to quarantine. Second is the hospital who's taking COVID patients in case he's not just a symptomatic, he's a moderate or a severe case. Third is an ambulance which can transport this patient from you to the hospital or the designated center, which has adequate precaution. And fourth is the you should be informing the local authorities about this patient. So you should know the address and everything. So you should be registering the patient, taking his phone number, taking his area and everything. Uh, there are different things, different kinds of recommendations on all of these sites where they say, because in India we still not in stage 3. That's what the government is saying. So that's why people in the US have already started taking all these flu patients in these small clinics as well. So I don't know, if we should be taking them right now, or we should be sending them to the COVID hospitals or clinics designated for them. uh, After you've done that, you should ensure before the patient enters your clinic, you should ensure that he's got a mask. As soon as he enters your clinic, you should ensure that he has performed hand hygiene. If he's performing hand hygiene with soap and water, it's supposed to be at least for 60 seconds. the directions of the WHO on how to perform hand hygiene should be written on your clinic. It's available on the WHO site. You can print it out and you can put it out on the clinic. Just by rubbing your hands a few times, it's now very safe and you're not killing the whole virus. If you're performing with an alcohol-based solution, which is you're supposed to perform at least from 20 to 30 seconds, again with the same kind of hand movements.
Sir, sorry to interrupt you. Its spirit is good.
So the recommendations say above 60% alcohol, the spirit is included. I am not sure what will happen to your hand if you're exposed to so much of spirit.
So, but soap and water means outside the clinic, how we can keep, because that basin is must be inside only, no?
Yeah, so that is a problem. The best way is, sir, we have a lot of vendors right now, and the cost of sanitizers and all of these hand rubs are they have come down like drastically since we have locked down. So now it's affordable, and every practitioner can have these solutions.
Yeah, I keep 4 bottles outside, and I keep one my assistant outside. As soon as patient enter, she will just spray and they will wash for at least 1 minute. Because as my wife is dentist, so she comes once in a week. She comes once in a week for surgery with all PPT kit, mask, and that cap sealed and all that.
So we will come to the PPE kits ahead in the presentation. So if you see earlier on the left side of this slide, we had all these decorations there. What we have closed down because cleaning all of that, those surfaces is not possible. Uh, Earlier, my entrance waiting area used to look like this at the left, which had certificates, which had some water and all kept for patients. We've removed all of that. No decorations, no paintings. If you see at the right, we allow so number of patients who can be inside the waiting area, or if it depends on your clinic how much area is available at your clinic. You might choose not to have waiting patients in your waiting area as well. Because I have some extra space, I allow 2 patients in this kind of a waiting area. We recommend somewhere around 2 to 3 meters of social distancing in this waiting area. Only one relative, we should inform them that only one relative will be allowed. Regarding the timings of the clinic, the timings of the clinic should be kept very limited, and it should be displayed outside the clinic. If in the future we start taking in patients who are symptomatic, which is cold cough, and which can be of course these normal regular cold cough and other flu patients which are not suffering from COVID, that is a practitioner's choice whether he wants to see them or not, or he wants to send them to a center which is taking COVID patients and get them screened. But if you're taking those patients who have cold, cough, and flu-like symptoms, you should call them at a separate time. You should forward on all of your patient databases that you are seeing non-symptomatic patients at this specific time. That should be before, earlier in the day, and afterwards you should see the patients who are symptomatic with flu or whatever.
Sir, one more, it is in my mind, as it is going to last long, and for us general practitioner or for you also, there will be a limited time period of practice. So, is it worth that we should increase our charge?
So I personally think the charges of medicine, because of the consumables we're going to use, it's going to go up. It is a personal decision. If you see the regulation, it's a personal decision of a practitioner in his private practice on how much he can charge. It's his personal opinion. Second is doctors like you and me, we always find a balance. We have different kinds of clinics where one place you see patients who are needy, Other place you see patients who are more or less affording. So it's a personal decision. I do not want to comment on that one. But the cost of healthcare is definitely going to go up, and it's not going to go up, it's gone up. If you right now, if you get admitted into a setup which is just quarantine, and I don't know how much right it is quarantining all of these patients who are asymptomatic in a hospital, you end up spending lakhs of rupees.
And I think, sir, nowadays after this corona, it is like triple market की जगह पे quadrant market आ जाएगा. HCV, HIV, Australia, and this corona compulsory.
Yes,
It is a
definitely.
protocol.
So
It
it is
will be a
happening, sir.
protocol. It will be a protocol type.
So it is already happening, sir.
Yeah,
So when I practice in Reliance Hospital,
pre-operative,
take two
pre-operative.
swabs. They take two swabs before admission to the hospital. They take one swab, and still because the patient has been in the community, and there is a chance that he is somehow in the window area. So that's why they are doing two swabs, and they admit a patient into a zone which is a doubtful area. I don't know what you call it in the scientific language. So it is not patients which are tested positive. It is patients which we don't know if they're positive or not. They take one more swab there, and then it goes to a treatment, a further treatment of surgery of whatever is needed. The question comes in when there will be an emergency surgery. If someone comes directly to the hospital, and if he needs an emergency
Yeah.
surgery, then this is going to be a disaster.
And who is this Preeti Jaiswal? Sir, who is Preeti Jaiswal? Is it physiotherapist?
She is, yes, she is a physiotherapist. She practices with me at Wholistic.
Okay. Hi, Preeti. Hi, Preeti.
So we will take the questions at the end, sir. They're all muted, and we can have the questions over a chat.
Okay, sir.
So let me move ahead. So if you see the reception, how it used to look earlier and how it looks now, all of us practitioners, there is a lot of lists, there's a lot of documents, there's a lot of paperwork. We should take it all off. I just have two pads. One is register the patient, name, address, phone number. Second is my prescription pad, is all what I have here. And we've cleaned everything else. The use of computer, I'm not sure it's debatable, but we make sure that this computer is like sanitized properly every day.
Sir, even mobile we used to sanitize, no, every time. Mobile, pen.
So now there's no way we can function without mobile phones. I sanitize it all the time. I don't know how safe it is. So if you see the qualities of this virus, it gets deadly once it gets in. But just by washing your hands and you're safe is what everyone is saying. Is what is stopping the spread. So I think sanitization of all of these gadgets is mandatory.
Yeah, and sir, when I met you last time, 2 days before, I got a real good new idea from you that to keep that mask in the sunshine, so it get destroyed and good. It was good things. I told many doctors also. Nice information you have given.
So that is what I do. Use of masks. You were asking me earlier, use of masks. Three-ply mask is what is recommended in clinical setups where you're not seeing COVID positive patients. A face shield is recommended. I'll come to that. So right now the slide is showing what used to be a yoga center earlier. We've turned it to a staff changing, donning and doffing of PPE kit section. This used to be my OPD. The sheets are off. it's recommended to take off the cushion as well, so that you can have the patient directly lie down on wood, so that it is cleaned properly. All of the stationery, the computer is gone. It's just one prescription pad and me. The distance between the doctor and the patient has to be increased. It has to be well ventilated. Best practice suggested by the WHO is there should be a window in the clinic which should be open, and a door which should not be closed even while you're examining a patient. But that puts question into your mind while examining a female patient. So your examination protocols are going to change. You are going to delay some things. You are going to delay some procedures which are not urgent. So that is all part of the parcel. Except this, the thermometers which we use, the PP cuffs which we use, the stethoscopes which we use, everything has to be sterilized between by at least
Torch,
once.
torch, torch.
Yeah, everything between patients, it has to be cleaned by sanitizers. Over one day, it should be cleaned with soap and water. All of these surfaces, the tables and all of that, I clean after every patient. The cleaning solution what is used, there are different surface cleaning agents which are available in the market. The cheapest one is also the sodium hypochlorite, which has been recommended by a lot of people. So the biggest dilemma, bigger than the earlier dilemma, should we use a PPE? So this is me at Reliance
Ita.
Hospital. I was supposed to examine a patient who had a back issue, and he was tested positive. So this is how you see a positive patient. So you can see it's a complete PPE. That time, this PPE had costed 1,800 rupees was the MRP, which definitely I cannot afford at my practice if I want to use this every day. This PP, in spite of being 1,800 rupees, it is made of permeable material, which means it is, if you throw a glass of water at me, if there is some kind of droplets, it can percolate inside. So I am not sure this is okay. Now hospitals have come up with those better materials, so not impermeable. The PP cost has gone down to somewhere around 800, 900. The hospitals who are functioning with COVID positive known patients who have a mass of heavy viral load in their wards, they are supposed to use this, is what I feel. Even the recommendations say that in your clinic you do not require such kind of PPEs. Then what is the option? What do we use? So but on the other hand, I've seen general practitioners, doctors, single owned clinic doctors, they are just using a mask, which I don't think is enough. So what did I do? I used something which is reusable. At the right is me with my team, my staff nurse, and my center manager. That is how we dress up. So what is used, and very interesting, how much does it cost? So I recommend, as soon as you come inside the clinic, you should keep, if your clinic starts at suppose 4, your staff should be there at 3:30. The cleaning staff will ensure that the whole sanitation process is done. You are supposed to change into your surgical pajama, which you can get from any vendor for 500 rupees. It's washable, it's reusable. If you can see, I'm at the center right now. We have t-shirts because it's also a sports place. So we are using our uniform. Over this, we use, which you see at the center of the slide, we use the surgical suit, which is also reusable, which is some 500, 600 rupees. Gloves, masks, and these shields. So shields, if you see in the picture, I'm wearing a 100 rupee shield. You can get for 100 rupees and you can reuse it. There is this shield what I just came across in the market. There's a company called Studs, and I have no association with them, but still I found the quality really good. There's this company located in Vikhroli. They used to produce bike helmets, and now they've produced these kind of helmets, and it's 250 rupees. The complete cleaning protocol of the whole setup, we have it with us. There's a lot of recommendations for hospitals. There's a lot of recommendation from the WHO. We have our own. We will be open to get in touch with you doctors and like have a personal chat on small tips on how in your personal situation we can help you out. Uh, but the cleaning protocols of the clinics is out of the scope of this webinar. It will be too lengthy. So that's why I've not mentioned it. How do you clean all of the objects like your toilets or your tabletops? It's a lot of material to be covered in this session. So other general information. This I've already mentioned, the OPD time. It should be minimum because you're not eating, your staff is not eating or drinking at your place. So that's why you should keep the timings limited. Reach to the clinic half an hour before. Frequently touch objects. This goes without saying. The knobs, the door railings, and everywhere you see the patient touching, just clean it. And as Dr. Rishikesh said, Triple H, when we operate, we always say if we do not have the Triple H, we treat all of the patients positive. So now is the time where we start treating all of the patients positive, because one by one we're listening to news of our colleagues getting sick, our family members of our colleagues getting sick. Some sadly have even lost their lives. Leaves and quarantine. So if you have adequate staff, I think you should not be using 100% of your staff. You should be segregating them into shifts, because there will be you should be functioning in minimum staff, how much is required, exposing everyone to a clinic, and everyone to at a one time is risking all of your staff. So you should plan it out. So the recommendations are you work 7 days and then you take a 14 days leave, which I don't see happening in the Indian scenario where the people are so less, when the doctor to population ratio is so less. So I don't know what kind of these window periods we should follow. But definitely, if there is a risk of exposure, if there is a risk of some of your staff or you getting positive or some kind of symptoms, you should definitely inform the authorities. You should definitely get yourself quarantined. So yes, sir. Rushikesh, sir, any questions for up till now? Rushikesh, sir.
जी डॉक्टर पंजी ऐड ला करे करें.
So I'll go ahead. I think there is some kind of a network issue. Services provided by Holistic Care. So because I have gained this kind of knowledge from reading all of this during the lockdown, because not much of surgery happening. Yes, sir. Rushikesh, sir, you are online.
Yes, sir. There was a phone call because there are 2 new cases I detected just now.
So I was asking any questions you would like me to address.
Sir, there are 2-3 more important questions. First is about timing and all. That is a nice suggestion. Then what you told is every time patient comes, that 1 minute this and change your tables and BP cough and all that. That is 100% appreciable. And most important thing, only one relative is also very good. But how to explain the patient to it takes so much time, surgery and all that, because this is compulsory for every now and then. I cannot advise COVID kara ke aaja. And second most important thing, how important is CBC, the new government has passed out some 4 tests: CBC, LDH, CRP, and SGPT. They claim that it is pre-COVID test. What is your experience about that?
So regarding the first one, regarding surgeries, if you're saying, are you asking me about symptomatic patients who are fever, cough, cold, or are you?
Yes.
So eventually, I think, sir, we will have to start seeing them all, and that's why this whole initiative. If you see a COVID, suppose if you're handling a ward of 40 COVID patients, the kind of protocols you'll follow, the kind of viral load you will have is different. And if you're seeing a suspected query COVID patient in your clinic, these are the protocols you will follow, and this, I think, this will keep you safe. It is in this, what is not included is the biggest thing, what I forgot to mention, is to train our housekeeping staff. This is the most important thing. I have seen, before you touch your face, it's definitely like, you should wash your hands, you should sanitize it. These housekeeping staffs are persistently touching their masks on their face. People are touching their masks on the front where it's wet. So wearing a PP and all of that, even if you wear a 3,000 or a rupee PP or a 1 lakh rupee space suit, and then if you just contaminate yourself somehow by doing something lousy like touching your face, it's not going to help you. So the processes and understanding all of these processes are going to help you. And I think we should soon start seeing all of these fever patients. And if you think they are like COVID, because if you see what's happening in the US right now, they are just telling, just go home. If you're not symptomatic, if you don't require hospital care,
Exactly.
go home and quarantine yourself.
Today, just now, I quarantined 2 people at home only. One is at Ghatkopar 60 feet road and one is at Pantnagar. I told them, you are asymptomatic, just be quarantined, isolate for 14 days. And sir, is Preeti is available to ask questions, reply questions? Is any breathing exercise will help, Preeti madam?
So yes. So sir, can I finish? There's a last slide remaining.
Okay. I don't know.
I'll finish.
Okay. Because sir, I am using this webinar for the first time in my life. Huh?
Sir,
to be very honest.
First time, but not last time. We'll do a lot.
No. It is interesting.
Viral, it would be great if after this slide we can ask questions. We have a question session from the viewers. So the slide, what can we provide? What can Holistic Care as a organization provide to all of you practitioners who've gathered here? So one is these protocols, which you should follow, thorough training, and you can get in touch with us, get in on an email with us. I'll be happy to personally see your clinic, firstly digitally through a video call. Secondly, I can also visit if it's nearby in Mumbai. Now there's no traffic, and we can revamp your practice so that you feel safe to practice. Second is we can provide you these.
Sir, one question.
Yes.
What will be the charges to change the clinic?
Sir, is it a question that how much I am charging? It's nothing, free.
No.
For the expertise.
You are free, we understand. But generally, if I want to change my clinic, because as you know my clinic, you have seen my clinic. I want to change my clinic. So generally, approximately how much charge it will be there? Approximately how much?
I just ordered all of this recently. It's consumables. It's like gonna be like first time if you're ordering everything, it'll cost somewhere around 1.5 to 2K approximately.
Oh, very good.
Yeah, and you will need your inventory cost will increase by about a couple of thousand every month because of all of these sanitation protocols.
So what I'm telling you, sir, can we jointly make some protocol type and we can print it out? These are the things before and what we require now and before. That is acceptable to you?
Sir, I have these protocols made in hand.
Manisha madam can help me out. Manisha is Dr. Talekar's wife. Okay. So if she can help us out too, so I can distribute to all the doctors in Ghatkopar. See, there are more than 1,800 doctors in Ghatkopar, GP.
Hmm.
So I can, put forward and something how, we can really guide them in a proper way.
Definitely. That's what we want to do, sir. We
Okay.
want
Okay.
to, we want that everyone goes back to work. They are safe. They're
So
serving
you
their
are,
patient. And
you are,
at the end of it, we should also start our practices. We have some kind of bread and butter coming in.
yeah. So you are in charge or madam is in charge of changing?
My home ministry is always in charge.
Your own home ministry, no? Because right. So nice to talk to you. Now question answer. Who is on another line? Who are they? Who are the other participants?
So, Vishal, can we take questions?
Vishal bhai.
Yes, Vishal, can we take questions? Preeti, I can see you've raised your hand. There is a box at the right side, and you can type your question here and we can address it. Yes, Vishal, can we take questions? Vishal, can you unmute the other people who have raised their hands? Preeti, I can see you've raised your hand. There is a box at the right side, and you can type your question here and we can address it. Yes, Vishal, can we take questions?
Where is the box? What's the question?
So I think, sir, we've been thorough in the approach, and I think most of us are not experienced with this app. So I don't see any questions coming up. Any other queries you have, sir, I can address that, or you can call us at 9136363669. Or we have our email address connect@holisticare.center.
So I think that will be more fine because people don't aware of how to ask the question also. It is better that two number you give. One is yours and another someone else of
So
your center.
definitely the group what we have found, and this session goes live on YouTube. So whatever questions they have, I can personally address them because it's a small group of people from Ghatkopar.
Okay.
I would like to get to know them.
I
and
will,
address
sir, I
all
will
the
pass
questions.
all these things.
Rishikesh sir, thank you very much for this opportunity.
So thank you very much. Thank you very much. Thank you very much. And
आपके बगैर नहीं हो पाता sir. Thank you.
This is the first experience. It was good. Thanks a lot. And thanks to ma'am also.
Bye.
Bye bye. Take care.